So let's talk for just a minute about chemotherapy. Chemotherapy is classified, of course, as a hazardous drug, and there's many more hazardous drugs that are out there. But chemotherapy and similar hazardous drugs should be stored in a separate area with an appropriate exhaust ventilation to dilute and remove airborne contaminants. You want to make sure that you're always following your institution's policies and procedures when working with any cytotoxic or hazardous drugs. These policies will cover such areas as personal training in the identification, containment collection, segregation, and disposal of these agents. The use of equipment, protective clothing, and procedures to follow this in case of exposure should also be described. Now, in terms of clean rooms, this is where laminar flow hoods and biological safety cabinets are found. The USP, which stands for United States Pharmacopoeia 797 regulations, state that clean rooms must be located in the pharmacy where traffic is very limited and airflow is unrestricted. Sterile products must be prepared in Class 100 environment. This Class 100 means that any airflow unit used in the clean room is capable of producing an environment containing no more than 100 airborne particles per size of 0.5 micron or larger per cubic foot of air. So keep in mind things of when you're talking about an area where there's not a lot of foot traffic, of you being in a situation that if you were working, if you had gone to a restaurant, you had somebody working in the kitchen, but all of the customers passed through the kitchen. You certainly don't want that to happen, no more than you would want somebody, preparing any type of sterile medication in an area where there was a high traffic. So those are things to kind of keep in mind.